According to the National Heart, Lung, and Blood Institute, almost 700,000 people die each year in the U.S., or about 29% related to heart disease. Sudden cardiac death from coronary heart disease occurs 900 times per day in the United States, as reported by the American Heart Association. And the risk to adults ages 35 years or above is about 1 for 1,000. This will be a brief overview of how to perform CPR. It will reinforce your previous training and continue to help keep your skills fresh. So what do you do when you come upon an unconscious individual? First thing you want to do is assess the situation. What caused them to be injured? Is it safe to enter the area? Check for downed power lines, possibility of poisonous gases, or any other hazards that may be present. Once you determine that it is safe, try to make contact with the victim, speak to them, and just find out that they're not laying there asleep.
Sir, are you okay? Is everything all right?
If you get no response and you believe that they may be unconscious, tap and shout loudly.
Are you okay? Are you okay?
Call for help. If there's people around, yell and alert them to call 911 for you.
Help, is anybody there? I need some help in here.
If there are individuals present, give them the information to give to 911.
Call 911, he's unconscious.
If you are alone, immediately call yourself. Unless you believe that the accident was respiratory related, as in a drowning, then give 2 rescue breaths and then call 911. Go ahead and perform your ABCs. Check the airway. Is it obstructed? Can you see anything that would be prohibiting them from breathing?
No.
Place your ear over the nose, which is where you will listen for breath sounds. Look at the chest. Determine, is the chest rising or falling as with natural breath?
No.
If you realize that there is no breath, check for a carotid pulse on the side of the neck using 2 fingers. If there is no pulse, begin CPR. Finding the xiphoid process by following the rib cage to the end of the sternum. Place the palm of your hand, pushing the heel onto the chest, interlacing your fingers, placing the body straight above the victim's chest, keeping your arms straight. Begin compressions using your body weight and ensure that the chest is compressing 1.5 to 2 inches during this process to allow the blood to flow. Perform 30 chest compressions at a rate of about 100 per minute. Give 2 breaths. Repeat this cycle, providing 100 beats per minute using the 30 chest compressions for 5 cycles. Check for pulse again. Listen for breathing. Continue to perform your CPR. If you have found that there is no pulse, there is no breathing, you'll continue this until help arrives. If after your assessment you realize that there is a breath or that their pulse has returned, you'll continue to monitor all of the breath and pulse until emergency medical assistance arrives. Remember that the Good Samaritan law has indicated for us through Texas law that we cannot be held liable for assisting an individual as long as we have rendered the care at the scene of an accident, that we are acting in good faith, that we are acting without the expectation of being paid, and that they are not willfully or wantonly negligent. We are doing our best to help. So in summary, remember, assessing the scene, getting help, performing the ABCs, checking your airway, breathing, and circulation, performing CPR and rescue breathing. It's always better to do something than nothing. Because remember, at this point, they're already dead. You cannot do any harm. Thank you.